In this video, we're going to introduce the concepts of PAILs and Rails. And so PAILs and Rails, basically they stand for progressive angular isometric loading and regressive angular isometric loading. And essentially what these are they are high intensity contractions, basically upwards of 80% intensity at the longest and shortest range of a joint. So PAILs is the end range, contracting the lengthened tissues, or kind of what I think of it as is getting into a stretch and then resisting the stretch. And then the regressive is the shortened angle, so basically the opposite side of the joint. So if you're in a very deep stretch, it's the tissue that's at its shortest point. So essentially what this does, PAILs and Rails is inducing adaptations and strengthening neurological control and function, strength function at the end ranges, so the shortest and the longest range of a joint. There is kind of a nervous system default mode where the tissue is the strongest kind of in the middle of the curve. And so what this does is it kind of broadens that aspect there. It is helping to grant us better access to those ranges of motion. And essentially it is kind of developing that joint protective, joint control, mobility concept. And so mobility essentially means that you have access and use of all of the range of motion of a joint. We don't want a rigid joint, and we also don't want a joint that's super flexible and bendy with no control. So what we're constantly trying to do with Kinstretch is figure out what your passive range is and your active range, and hopefully the two of them match as close as possible. If you have a ton of passive range and no control over it, the wrists are a good example. A lot of people have crazy, wrist extension, and they don't have any control over it. So you'll bring them back to here, and then they go for active control. Not a great scenario for the wrist. So basically all of this range is kind of sketchy range. And you might notice that we use this sketchy range a ton in push-ups or possibly handstands, walking on all fours. So you kind of want to bring those two as close together as possible because it means that you can stabilize the joint. And so this is unstable. This is basically just tissues kind of collapsing in on itself. We believe that if you kind of load and use this zone of uncontrolled range with loading, so basically if you're doing push-ups, it can lead to arthritis in that joint, and it's also more likely to be injured in those ranges. So for example, in our gym here, we have kind of changed the model of how we do kind of exercise technique qualifications. So it no longer is, does your squat count because your knees are, below your hips are below your knees and yada, yada, yada. It's, are you squatting within your active range? So what is your active hip flexion? If you're using a barbell to drive you below that active hip flexion, then essentially you are loading a passive range. So PAILs and Rails is trying to develop the strength to control all of that range of motion. We use PAILs and Rails also to build more range. So the way that we do that is we will stay in a stretch for at least 1 minute. When I say stay in the stretch, I really mean stay in the stretch. So once you initiate a stretch, you don't want to back out of it. You want to stay in that position. It's kind of like a clock starts. If you keep coming in and out of the position, you are constantly resetting the clock. And the nervous system responds to kind of that time where it says like, okay, I'm here for a while. It starts to kind of override the stretch reflex. What really overrides the stretch reflex is the PAILs contraction. So then you're going to perform a 10-second PAILs contraction. And like I said before, this is essentially strength training. Strength training works upwards of 80%. We're trying to teach the nervous system how many motor units it needs to recruit to produce kind of a max effort contraction. This way, if you think about an injury occurring to a joint, what typically happens in an injury is that the force incurred to the joint is greater than the joint is able to withstand. So if we're doing, and it's usually kind of going to happen at an end range of a joint. So if we're trying to stop somebody who's running by us, and we've been doing strength training at high intensity in this position, we're less likely to damage our shoulder versus someone who is never doing any work back here and the arm gets taken all the way back, likely to tear the shoulder joint up. So we're doing that high intensity strength training with the hopes of basically protecting the joint, teaching it how to work in that new position. And then the same thing with the opposite side of the joint. So usually people will get a Charlie horse when they try to tense tissues when the joint is at its shortest range. So the great example you'll discover when you're doing a quad stretch and then you try to hold the leg there, the hamstring will likely Charlie horse. It's because the nervous system doesn't understand how to use how much motor units to activate. So it produces a Charlie horse where everything is firing all at once. So once you've done the PAILs contraction overrides the stretch reflex. You gain another 10 to 15 degrees. Then we spend another minute in a deeper stretch to basically kind of reaffirm this range. Then we will use some CARs after that to help the nervous system gain control of that new range. And this is how we develop range of motion. This is how we develop active control of that range of motion, thereby making it safer, thereby protecting the joint and making it a little bit more bulletproof for injury. When you're just starting off, there are a couple of things to pay attention to. Like if you have a massive discrepancy in your active and passive range, I would recommend backing out of your passive stretch a little bit before you do the rails contraction. So you can go ahead and PAILs in the deep end range of the stretch, but at the end of that, back off a little bit to kind of, just where you can lift off before you start the rails contraction where you're pulling back, contracting those shortened tissues. Rather than being all the way back here trying to pull, it seems to be a little bit more functional to progress that active range rather than go so far outside of where you have control. Also, if you have pain whatsoever in any of these joints, you want to keep those contractions to within what that joint can withstand. So PAILs can be used as a rehabilitative thing, just up to the point of where the tissue feels a little bit unstable, tweaky, painful. Don't go back, don't go beyond that. So don't use the high intensity unless everything is okay. If you're not sure, if you have a joint that is sometimes sketchy, I would recommend starting with lower intensity contractions, just kind of like any strength training program, seeing how it goes afterwards for a few days, and then if everything's fine, then the next time you come in, go ahead and up that intensity. And that's it. That's PAILs and Rails, essentially in a nutshell.